You're back, and so am I. I'm so glad to see you again. Do you realize how much we've progressed in this education? I mean, every single video is a progressive step in the direction of successful menopause management. So this is video number 349 in our unit on cervical cancer. We've progressed through a comparison of cervical and endometrial uterine cancers in video 340, to the risk factors in video 341, to the anatomy in video 342, to the pathology in video 343, to the symptoms in video 344, to the pap smear in video 345, to the causative agent in video 346, to HPV testing in video 347, and to diagnosis in video 348. That's a lot of progress. You know, one of the many ways in which I'm odd is that I pay a lot of attention to words and figures of speech. And as I use the variations of the word progress in greeting you, it got me to thinking about how we use and pronounce various permutations of that word. As a verb, most people say progress. But as a noun, people usually say progress. I don't know why the pronunciation changes. And then there's the emphasis on the first syllable versus the second syllable. So there's progress and progress, and there's progress. Anyway, today we'll be talking about the progressive grades and stages of cervical cancer. And I'll be using variations of the word progress and progress a lot. I might even use the pronunciation progress. As I've indicated in all the previous cervical cancer videos, this material is not in my book. This is one unit that's a YouTube bonus, so keep watching. Back in video number 314 in the unit on cancer in general, I introduced you to the concept of grading and staging of cancers. You learned that they are a way of ranking the cancer in terms of how much it has progressed. They are different from one another in that grading pertains to the actual cells that transformed into cancer cells, whereas staging pertains to the overall spread of the cancer. So you can think of grade as the microscopic degree of progress and stage as the macroscopic degree of progress. Grade takes into account the degree of differentiation of the cancer cells based on microscopic examination. Now, you've seen this board many times. It starts out with precancerous changes called dysplasia here, and they progressively become more and more disorganized until they turn into neoplasia here. Neoplasia is cancer at the cellular level. And once you have neoplasia, the neoplasia can fall into one of three progressively less differentiated forms that dictate how aggressive the cancer is. Differentiation is really a measure of how different the cancer cell is from a normal cell. The more differentiated or different it is, the worse the cancer is. So, a well-differentiated cell is very close in appearance to a normal cell. A moderately differentiated cell is halfway between a perfectly normal cell and a severely abnormal cell. A poorly differentiated cell is so unlike the normal cell that it is difficult to recognize or identify the cell type at all. And another name for poorly differentiated cells is anaplastic cells. I hope you realize that everything I've told you so far is review. If you think I'm progressing through this material too quickly, it's because you have not watched my videos in order. If you want to completely sabotage your menopause education and encounter complete lack of progress, watch the videos randomly. So, last week, when we discussed how to make the diagnosis of cervical cancer or precancer, I told you that you do so by taking biopsies of the cervix with this instrument. Well, those biopsies go to the pathology lab for microscopic evaluation. And that's when you designate the grade of the cancer. That's where you assess the individual cells and determine how much they differ from normal cells. The pathologist uses only 4 grades for cervical cancer, all based on microscopic exam. So it goes like this. Grade X is grade cannot be assessed. G1 is well differentiated low grade. G2 is moderately differentiated intermediate grade. And G3 is poorly differentiated high grade. At that point, though, you have no information on how much the cancer has spread. In other words, how far it has progressed. That is defined by stage. The stage of a cancer designates how far it has spread. So this pertains to the 5 steps of cancer progression that I delineated in video 314 on cancer assessment. They are transformation, proliferation, invasion, metastasis, and dissemination. The universally accepted staging system for cervical cancer is the Fédération Internationale of Gynecology and Obstetrics System, or FIGO. All gynecologic cancers are staged according to the FIGO system. Some are more detailed than others, and it just so happens that cervical cancer has one of the more detailed FIGO staging systems. Generally, it uses 4 Roman numerals to designate the extent of progressive spread of the cancer. The simplistic version is what I'll give you here, and that's because each of the 4 Roman numerals has 2 or 3 subcategories that are very specific, but they would overwhelm you. So here's the basic staging for cervical cancer. Stage 1 is the cervix only. Stage 2 is beyond the uterus. Stage 3 is the lower vagina to the pelvic wall or to lymph nodes. Stage 4 is beyond the pelvis to the bladder and rectum. Now, the designation to pelvic wall just means that the cancer is still within your pelvis and confined to your reproductive tract. But it's confusing because your pelvis includes structures other than your reproductive structures. Anatomically speaking, your bladder and rectum are in your pelvis too. That's why some of these staging systems can be a bit confusing. They're really designed for medical people, not laypersons. And stage 4's designation of spread beyond the pelvis includes metastases. Metastases are cancer cells that show up in organs far away from the organ in which the cancer originated. Metastases are cancers that bounce around without spreading gradually and logically from one structure to the next. Instead, they travel via lymph or blood to distant organs. It's sort of what you do when you learn things out of order. Instead of connecting one piece of information to the next in a logical, organized manner that ensures complete understanding, you get nothing but bits and pieces of this and that with no connections between them. Now, going back to the various permutations of the word progress and progress, some kinds of progress are desirable, others aren't. For example, it's desirable for you to progress in getting this education on menopause. So reaching higher and higher levels of understanding is a productive and beneficial thing. But when it comes to cervical cancer, progress is undesirable. The more progressive the stage, the worse your situation. And the combination of grading and staging is what dictates treatment. So our next area of concentration will be on treatment, but I'll wait until next week to teach you about that. Don't you just love the way each video progresses to the next? It's just so easy to learn this way. Ironically, if only people progressed in their manner of learning in as predictable a fashion as cancer typically spreads, we'd all be a whole lot smarter. If you dart around trying to learn things in bits and pieces, a soundbite here and a soundbite there, you'll be like a cancer that metastasizes rather than one that progresses gradually from one stage to the next. So the summary for today is that cervical cancer has progressive grades of differentiation that dictate how abnormal the cells are, and progressive stages that designate how far it has spread. If you'd like a copy of the charts, you can find them via the link in the description box, or you can go to menopausetailor.me where you'll find all my charts. And if you want to continue your progress in learning all you need to know about cervical cancer, come back in a week. Please go to menopausetailor.me to schedule a consultation. I do them with women all over the world, and they're all via video conferencing on my own video platform, so everybody can have a consultation. Follow me on Facebook, Twitter, Pinterest, and Instagram if you like, and sign up for my newsletter. I send one out every 2 weeks with all sorts of topics, tips, clarifications, and promotions. I also announce giveaways in my newsletters. And be sure to subscribe right here to Menopause Tailor on YouTube. Bye!